I'm Margaret Brennan in Washington, and this week on Face the Nation, the Biden administration's booster shot plans hit a roadblock, and Congress gets set for a fall budget showdown. There is relief this morning in the nation's capital as a strong show of security at Saturday's rally in support of those arrested following the January 6th insurrection kept the crowds away. Nothing like the scene 9 months ago. Now the focus turns to lawmakers as both houses of Congress return to Washington for the first time since the end of July. First up, consideration of a massive $3.5 trillion spending plan that threatens to shatter the fragile fault lines within the Democratic Party. We'll talk with Vermont Senator Bernie Sanders. Plus, an FDA advisory panel overwhelmingly votes against widespread booster shots for adults, saying the data is inconclusive. We'll ask the director of the National Institutes of Health, Dr. Francis Collins, what happened. Plus, we'll have a special conversation with former FDA Commissioner Dr. Scott Gottlieb. His new book, Uncontrolled Spread, takes a hard look at America's COVID failures and offers some solutions.
We cannot allow something like this to hit us this bad again, so we have to prepare differently.
We'll also talk with United Airlines CEO Scott Kirby about how the travel industry is navigating the persistent pandemic threat. Plus, a look at the fallout from the U.S. military's tragic mistake last month in Afghanistan. It's all just ahead on Face the Nation. We're back now with the chairman of the Senate Budget Committee, Vermont Independent Senator Bernie Sanders, who joins us from Burlington. Good morning to you, Senator.
Good morning.
Lots to get to with you today, but I do want to ask your reaction to news that the U.S. military killed 7 children, 3 civilian adults in this drone strike. You have in the past been very critical of reliance on drone strikes. Are you comfortable with the Biden administration's over-the-horizon policy?
Well, I certainly hope they understand what happened and make sure that never happens again. This is not only a human tragedy, it reflects on us before the entire world. It's unacceptable.
On immigration, I also want to get your reaction to what the Biden administration just said they're doing this weekend, which is to step up deportations, particularly of some of these Haitian migrants who have gathered in southern Texas, thousands of them. Congresswoman Ilhan Omar has called it inhumane. Do you agree with her? And looking at what you're working on right now on Capitol Hill, do you expect immigration will be tucked into this $3.5 trillion spending plan?
I hope it will, in the sense that right now we have many, many millions of undocumented people in this country, people who are working hard. In fact, people who have maintained this economy, people doing the essential work, something like 11 million people. And I would hope very much, and I think the American people agree, that now is the time, and if we can do it through reconciliation, I'm there, I want to do it, to move toward a path toward citizenship and comprehensive immigration reform through the reconciliation bill.
But
that's my hope.
Whether or not that can be done is still going to be decided. I know you say you want it done, but isn't this exactly the same kind of social policy that moderates are balking at here? Well, because you're tucking it into a mechanism that even Margaret, you have said in the past should just be used for budget and spending.
Well, the truth is that because we have no Republican support in trying to pass a significant piece of legislation representing working families, we have to do it through the so-called reconciliation process, which means that you have to obey the Byrd rules. I won't go into bore you with all the details. So it's something that we are arguing right now. But I do hope, as we move toward what I believe is the most consequential piece of legislation for the working class of this country, as we demand that the wealthiest people and large corporations start paying their fair share of taxes, as we lower the cost of prescription drugs, as we expand Medicare to include dental care for seniors and hearing aids and eyeglasses, as we lower the childhood poverty, as we have already done, maintain that by 50% as a result of the American Rescue Plan. I hope that immigration reform is part of that general package.
But don't all these very worthy causes you're laying out deserve their own debate and consideration? You in the past have said that this is not how
Margaret, right now we have no Republican support. Zero. There's not one Republican who is prepared to stand up to the drug companies and lower the cost of prescription drugs.
And you may not have full Democratic support
Not one Republican
either.
who wants to build affordable housing. We can't do it without the reconciliation package. So right now what we are doing, and let's be clear, and I want the American people to understand it, we're taking on the pharmaceutical industry who are spending millions and millions of dollars trying to make sure they could charge us 10 times more than the people of other countries for drugs. We're taking on the healthcare industry, does not want to expand Medicare. We're taking on the fossil fuel industry, who thinks it's okay to continue emitting carbon while destroying the planet. So this is really a monumental struggle.
I understand it's monumental, and it's a struggle within your own party, to be frank, because Senator Manchin just met this week with President Biden. He continues to say the number you're asking for is too big, it's too much. Will you meet with the president this week, and do you plan to give anything here to get closer to the numbers that the moderates in your own party say need to be met?
Well, let me tell you this. We have started off, as you know, with, I would guess, 80% of the Democratic caucus supporting a $6 trillion bill. Remember, this is over 10 years. Per year, it's less than we spend on the military. Now, maybe you can tell me, or somebody else can tell me, how much we should spend to save the planet. Because what the scientists are telling us is that if we don't get a handle on climate change within the next few years, there will be irreparable damage. And you know what? I got 4 kids and 7 grandchildren. And I think we have a moral responsibility to leave them a planet that is healthy and is habitable.
Are you sure
that we are
that
working right now? We got 50 votes. We're going to have to work it out as we did with the American Rescue Plan. But I have already made, and my colleagues have made, a major compromise going from $6 trillion down to $3.5 trillion.
So am I hearing you correctly when you say you are not willing to move on that $3.5 trillion number, even if the president asks you to do it? I mean, are you risking losing everything?
Look, right now what we are doing is we are engaging with the House and the Senate. It is a complicated proposal. All I am telling you is that $3.5 trillion is much too low. A compromise has already been made. An agreement has been made. And the American people, by the way, poll after poll after poll, are telling us now is the time to stand up to powerful special interests. Now is the time to start representing working families on all of these issues. They are enormously powerful. And maybe, just maybe, we can work for workers for a change and not just wealthy campaign contributors.
You keep saying the number of 50 votes, but it is well reported that Senator Manchin and Senator Sinema are not with you on this within the Democratic Party. Are you certain that President Biden will get them all in line?
We went through this with the American Rescue Plan. We dealt with this with the American Rescue Plan, which, as you know, is the most significant piece of legislation to take us out of the economic decline. And it cut childhood poverty by 50%. It provided unemployment benefits. It did what had to be done to get us out of the emergency. We came together, and I expect, because of the pressure of the American people, we're going to come together again and do what has to be done.
Will you meet with President Biden this week, just like Senator Manchin did last?
I'm happy to meet with the president anytime. But at the end of the day, I think what the overwhelming majority of the American people want us to do is finally stand up for them, not just the drug companies and the healthcare industry and the fossil fuel industry. This is what we are trying to do. It's an enormous fight. We're going to win it.
It's an enormous fight, and we will track it. Thank you very much, Senator Sanders. Welcome back to Face the Nation. We go now to United Airlines CEO Scott Kirby, who joins us from State College, Pennsylvania. Good morning to you.
Good morning.
United has said 90% of your employees are vaccinated following your mandate. What about contractors? And for someone buying a ticket on your airline, how confident can they be they won't run into someone unvaccinated?
Well, there are a lot of people that work in the airports that don't yet have a vaccine requirement, though the administration's rule is going to ultimately take care of that. But one of the things that's important when you're traveling on an airplane, particularly once you're on the airplane, it's really the safest place you can be because of the airflow on an airplane. Safest place you can be indoors. And so wear your mask in the airport. That's a rule. And before long, we'll have everyone in the airports vaccinated thanks to the administration's order.
Well, the Delta variant is causing problems in terms of people's willingness to buy tickets to get on planes. Your company announced that you're going to lose money the next 2 quarters. Why aren't people flying?
Well, the Delta variant has obviously caused a downturn in travel. It's particularly business travel. A lot of offices were expecting to be open again in September, and the Delta variant has pushed those opening dates back a few months. My guess is that it'll now be January. It appears that we've peaked in cases. Let's hope that that's the case. Let's hope that as we continue to get more people vaccinated, we really can get back to normal across the country. But the demand recovery has really probably been pushed back to January.
We'll watch and see. Would you advise the administration that they roll out another wave of mandates, this time for passengers? You know, if TSA screens you to make sure you're not hurting your other passengers potentially, should they also check your card to see if you're vaccinated?
Well, I think the administration is doing a really admirable job of trying to find all the levers to push to get the whole country vaccinated.
And they're discussing
and they've
this.
really got
Should
better
they do
data
it?
and science. You hear it sometimes, but I think their administration's perspective has been that getting people vaccinated at work, it's a one shot, and you can really get a whole bunch of the country, you get a high percentage of the country, as opposed to making it a burden on people that are vaccinated every time you get on a plane, a train, any kind of public transportation to prove that you're vaccinated. And so for now, I think their approach of focusing on the employment and focusing on work is probably the right way to go. But they've got great data and science, and if they tell us that they want us to check everyone, we're prepared to do that as well.
When it comes to data and science, Dr. Scott Gottlieb, the former FDA commissioner, has argued that the Biden administration's travel restrictions that they've kept in place on Europe, on India, on China, other countries, they don't really work. Have they given you a timeline on when those restrictions will be lifted?
They haven't given us a timeline specifically, but they do talk to us a lot. And you know, I think they're just trying to take a cautious approach and really put safety first as they go through the crisis. And given the case rates, you know, in Europe and the U.S. are similar, and the high vaccination rates higher in Europe, actually, I'm hopeful that we'll get those borders, particularly to Europe, open soon. But they're following the data and the science. But we hope that as cases come down, that's something that'll happen soon.
Do you think that's a political decision?
I really think that they're just focused on trying to do the right thing here. And this is a lot of uncertainty around what it means. And I think they're just focused on the right thing.
I want to ask you about some of what's being debated here on Capitol Hill. There are 2 huge bills. One of them, this $1.2 trillion infrastructure plan, it's got funding in airports included into the package. How necessary is it, and how would you want that money to be programmed? What do you need it for?
Yeah, so I am very supportive of the entire infrastructure package, as is most of the business community. It's a great opportunity to invest in America coming out of this crisis. And at airports, you know, you can fly around and see the airports. It's been a long time since we've had real investment in the airports. Our air traffic control system, you know, still flies in a lot of ways the same way we flew 50, 60 years ago. And there's real opportunities to make it more efficient and be good for the economy, good for customers, really kind of good for society as a whole.
So you're for the 1.2. When it comes to the $3.5 trillion spending bill, there's also some climate change related provisions tucked into it. We talked about that with Senator Sanders. But for you in private business, is it just so expensive to make some of these changes on your own that you need American taxpayers to provide tax credits and to provide incentives for private businesses to go green?
Well, particularly for the climate change initiatives, we do need government support really to fund the investment. Like if you look at solar and wind, 20 years ago, they couldn't compete with coal or natural gas, and today it's cheaper. That's because the government provided credits to give certainty to invest in the industry. And that's what we need for things like sustainable aviation fuel. This really is an opportunity in America to drive investment, drive the next generation of great jobs. They can be green, but also great jobs, great technology that we can export around the world.
So for you, the benefit outweighs the risks here of spending that much money.
Well, the climate change elements are a part of the $3.5 trillion. So the climate change elements in particular, and I don't know 100% of what they are, but the ones I do know about, I'm very supportive of and hope that they pass either in this bill or somewhere else.
We'll watch. Thank you, Mr. Kirby, for your time this morning. We'll be right back. Former FDA Commissioner Dr. Scott Gottlieb has been a valuable resource for this broadcast and our viewers throughout the COVID crisis, helping us cut through the confusion to tell you what you need to know. His new book, Uncontrolled Spread, takes a critical look at the mistakes America's leaders made in responding to this pandemic and how we need to better prepare for the next one. We sat down with him last week.
I think that the public health establishment as a whole has taken a hit in the setting of this pandemic. And this isn't just a sort of Republican, Democrat, conservative, liberal thing. I think that there's a lot of people around the country who feel that the advice they got from public health officials wasn't precise, changed, wasn't formulated in a way where it was sort of immutable, wasn't carefully explained, wasn't propagated in a way that it could be assimilated into people's lives. You know, how do I wear a mask? What mask should I wear? When should I wear a mask? When not? And things changed. And so people were confused by it and lost confidence in it.
You say the CDC, which is supposed to be the gold standard public health agency, doesn't have an operational capability to manage a crisis of this scale. So if the CDC doesn't, who does?
Nobody does. I mean, there was a perception early in this crisis that the CDC has this, that they would have the capacity to develop a diagnostic test and deploy it and gather the data that we would need, sort of scope out what the contours of the response would be, and they would be able to deploy the diagnostic test and deploy the vaccine and stand up this infrastructure. They're not a logistical organization. CDC has a very retrospective mindset. It's a high science organization that does deep analytical analysis of data that's oftentimes out of sync to when the decisions need to get made. They're not the Joint Special Operations Command. They don't surface real-time information to inform current policymaking.
They're not a quick reaction force.
Right. They'd rather take the data, analyze it for 4 months, and publish it in the Morbidity and Mortality Weekly Report. And the idea that they were going to be able to mass manufacture a diagnostic test and forward deploy it, they contaminated their own tests. So they botched the manufacture of their test.
We needed to turn to private industry earlier in the pandemic.
We needed an all of the above approach. Certainly by the end of January, we had enough awareness that this could be a global pandemic that someone could have hit the red button and said, we need an all of the above approach here. But CDC had the ball. The CDC was following their standard blueprint. Their blueprint could keep up with a slow-moving outbreak, but in a fast-moving epidemic like this, it was unmatched. Now, CDC should have raised their hand and said, we really don't have this. I think
Why didn't they?
I think it's very difficult for an agency to have this self-awareness that they don't have the capacity to respond in the way they're being asked. We need to get FEMA and the DOD engaged with the CDC in trying to organize a national level response. And that was a failure of political leadership. I mean, and it was a failure of vision, but you know, there were a lot of people who were good political leaders who wrongly assumed the CDC had this mission.
You say the point isn't that federal health officials were wrong. The point is they were working with faulty tools, faulty data sets. They didn't know what they didn't know.
They didn't understand that this wasn't spreading like flu. If you're just looking for flu symptoms, you might not see coronavirus spreading. So they were very confident early on that there was no community spread. We should have been doing things differently in anticipation that this probably was spreading. We just weren't picking it up, which in fact was the case.
You also say this should have been viewed as a national security threat, and that's how we need to think of pandemics.
I think the intelligence community has different tools that should be focused on this mission. We have to look at public health preparedness through the lens of national security. We make certain preparations for things that are unlikely to happen, but if they happen, they're so catastrophic that we have to prepare. We cannot allow something like this to hit us this bad again. So we have to prepare differently domestically. But internationally, we rely on other nations to tell us when they have an outbreak. That has repeatedly failed. It failed in this case. China didn't surface the early information. They still haven't shared the source strain. So the question becomes, can we still rely on the international health regulations and the WHO and the World Health Assembly? Are we going to all hold hands again and promise that we really mean it this time and we're going to share information? Or do we need to get our clandestine services more engaged in this mission? And I think we're going to need to get our clandestine services more engaged in this mission. There was data very clearly available in China, in Wuhan, that if we were looking for it, we could have detected this much sooner. We could have answered some key questions. We could have seen the asymptomatic spread. We could have seen the human-to-human transmission. You could have had some key questions answered early that could have allowed us to mount a more robust response. And a 2 or 4 week head start on something like this can make a very big difference.
What did you learn in the course of your research about the origins of COVID?
I learned that we're not going to answer this question absent one of two things happening. Either we find the intermediate host, the animal that was the that spread COVID, or there's a whistleblower inside China, or someone close to this who knows that this came out of a lab, comes forward, defects, goes overseas, or we intercept some communication that we shouldn't have had access to. Absent something like that, we're not going to be able to answer this question. This is going to be a battle of competing narratives. I think over time, the side of the ledger that says that this might have come out of a lab has grown more robust, and the side of the ledger that says that this came out of a natural species has not really moved.
When you say came out of a lab, you are saying through a lab accident, not a construct.
The administration has said this in the intelligence report they put out. They've sort of firmly debunked the idea that this was something that could have deliberately come out of a lab or was deliberately engineered.
Why do we need to know who patient 0 is?
If we determine that this came out of a lab, or we even assess that there's a high probability that this came out of a lab, I think it changes how we try to govern research internationally. The most speculative, most dangerous research often goes to the countries willing to conduct it, and the countries willing to conduct it are oftentimes the countries that have the poorest controls. The other thing we're going to need to look at is, do we continue to do things like publish the sequences of novel viruses? Once you publish that sequence as part of normal scientific discourse and part of the scientific process, you basically provide a recipe to anyone who's a rogue actor on how to manufacture that virus.
We're going to take a quick break, and we'll be back with a lot more of our conversation with Dr. Gottlieb, so don't go away. We're back with more of our conversation with former FDA Commissioner and Pfizer board member, Dr. Scott Gottlieb. What is the lesson for the Biden administration as they roll out boosters? Do they need to change the playbook from what the Trump administration did?
Yeah, I think the logistical lesson on the rollout of the boosters is that they need to have in place the infrastructure to actually distribute those vaccines in hard-to-reach communities and hard-to-reach settings. I think what the Biden administration has done here is by backing into an approximate date, they're now able to start that planning process in advance. If FDA does authorize it and the advisory committee, the CDC, ultimately judges it to be appropriate for a certain population, they're going to be ready to start making it available in the nursing homes right away. So there's not going to be a delay. So I think they're in a better position. I don't know that the vaccine boosters are going to be controversial from the standpoint of sort of right versus left politics. I think where the fault lines are going to be is on some of the mandates that the administration is putting in place.
How does it sit with you when you hear members of your party, the Republican Party, describe all this along civil liberties lines, not making the medical argument, but simply around civil liberties?
Hey, look, I think it's a misjudgment. There is this argument that this is an individual choice. Your choice to get vaccinated is an individual choice, and it's not an individual choice. This is a decision that affects your community. This is a collective choice. If you go, and just like with childhood vaccinations, if you go into a school setting and you're not vaccinated for measles and you introduce measles into that setting, you're affecting your community. So I don't think governors should tell schools and businesses you can't mandate a vaccine. If a business makes a decision that the only way that I could protect my employees or my customers is by having a fully vaccinated workforce, they should have the ability to make that decision.
But it's not just shots. We're talking about masks.
And the mask debate is inexplicable to me. Like I can't decouple it. I can't explain it. I can't defend it. People generally have an apprehension about taking a medical product, especially when they're healthy, especially for a preventative purpose. I understand just sort of people's general questions and concerns about a novel medical product. But a mask is such a simple intervention. It's not going to cause you any harm. It's just an act of, community responsibility. It's an act of respect. And I think the federal government's well within its right to mandate vaccination for federal workers, for healthcare workers. I think even mandating vaccination within the Medicare program could be something that's defensible. But when you impose the mandate down to the level of small businesses, now you're setting up the political fault lines. And you're taking something that was sort of subjectively political, and it's going to be objectively political. So are you going to get enough benefit from a public health standpoint for the price you pay in terms of hardening those lines? I think that was worth a very vigorous debate. I hope the White House had it.
Which governors handled this the worst?
Certainly looking at South Dakota, where this was just allowed to travel largely unfettered with public health interventions, where you saw one of the highest death rates per capita. You have to look back and say that was a bad experience. Once we learned how to treat this, once we were able to reduce the case fatality rate by half by the summertime, and we got there pretty quickly, states that were still excessively engulfed by this and had a lot of death and disease, those were in part policy decisions. Those were in part the result of policy choices that those states made.
I think about the first few days where this strange virus that was just surfacing started to make headlines here at home, you were starting to see things that weren't yet really being raised as red flags. How are you on the outside seeing things that they weren't seeing on the inside?
There was a presumption, again, that the CDC has this, the department has this, the Secretary of Health and Human Services is in control. So they let that healthcare apparatus run with the ball. It really wasn't until probably more like the end of February, the March timeframe, that you saw the White House really starting to get engaged and pull this away from the Secretary of Health and Human Services and the healthcare institutions and start to at least try to more actively manage it. And that was the genesis of the coronavirus task force.
It's been reported that you were actually considered to come and run that task force. Is that true?
You know, I don't know for sure. The president asked me to come in. I met with him. I met with the vice president and asked me to take a position as sort of as an advisor or helping oversee the task force after the vice president had been put in charge. That felt like it was moving along and more real. Ultimately, it didn't come together.
Why?
I don't know for sure. There were probably people in the White House who wanted to see me in that position and probably people in the White House who didn't.
Do you regret, though, not being on the inside? You had been with the Trump administration until 2019.
So I regret not being at the FDA. I don't know that there was much that I could have done dramatically differently inside the White House. And eventually, I would have worn out my welcome because there would have been people inside the White House who wouldn't have liked what I was preaching. If I had been at FDA with my staff, working with the career staff in the device center, I'm pretty confident that we would have made a very hard pivot to try to instigate the private industry to start getting engaged in developing diagnostic tests early in January.
And so you wish somebody at the FDA was doing that?
I think that would have had to happen at the commissioner level. It couldn't happen below that level. If I would have called any big manufacturer, though, they would have done it. I have no doubt about that. Having been there and having made those calls and having known that CEOs responded positively in moments of public health crisis, that's the one thing I wish I was there to do. And, you know, I wrote articles about doing that at the time. I was writing articles in January, this is what we should do. But, you know, writing op-eds and putting things on Twitter isn't like being there and actually being able to pick up the phone and effectuate the action. I wish I was there. I think that that's the FDA and the OPTIVs, the operational divisions of HHS, is where the action happens. That's where you can really affect the outcome. Affecting the outcome from the White House, much harder.
As you write in March when you went in to speak with the president that he was serious, he knew the grave risks.
There was a point in time when they were very concerned about this, willing to take dramatic actions. But later on, their attitudes really changed to the point where when the president was contagious with COVID, he ceremoniously took his mask off. And so what message does that send to the country? But my view is that they were sold on the idea that you weren't going to be able to really affect the spread, and that anything you did was just going to have so many repercussions in terms of impact on children who might not be in school, impact on the economy, that the costs were worse than the disease. And the schools is a perfect example of the lack of effective policymaking. So the single reason why most schools remained shut was because the CDC was telling them they had to keep kids 6 feet apart. If CDC had said you have to keep kids 3 feet apart, then a lot of schools would have been able to open. And in fact, when the Biden administration wanted to open schools in the spring, this past spring, they got the CDC to change that guidance from 6 feet to 3 feet.
And you're right, the 6 feet was arbitrary.
The 6 feet was arbitrary in and of itself. Nobody knows where it came from. The initial recommendation that the CDC brought to the White House, and I talk about this, was 10 feet. And a political appointee in the White House said, we can't recommend 10 feet. Nobody can measure 10 feet. It's inoperable. Society will shut down. So the compromise was around 6 feet. Now imagine if that detail had leaked out. Everyone would have said, this is the White House politically interfering with the CDC's judgment. The CDC said 10 feet, it should be 10 feet. But 10 feet was no more right than 6 feet and ultimately became 3 feet. But when it became 3 feet, the basis for the CDC's decision to ultimately revise it from 6 to 3 feet was a study that they had conducted the prior fall. So they changed it in the spring. They had done a study in the fall where they showed that if you have two masked individuals, two people wearing masks, the risk of transmission is reduced 70% with masks if you're 3 feet apart. So they said on the basis of that, we can now make a judgment that 3 feet is an appropriate distance, which begs the question, if they had that study result in the fall, why didn't they change the advice in the fall? Why did they wait until the spring? This is how the whole thing feels arbitrary and not science-based. So we talk about a very careful science-based process, and in these anecdotes get exposed, and that's where Americans start to lose confidence in how the decisions got made.
You do put blame on President Trump for a few things, but do you think, fundamentally, looking at everything you've analyzed, that the outcome of this pandemic would have been different if President Trump wasn't in office?
Well, look, it would have been different if we had different political decisions and the White House was exercising different leadership. There's no question about that. There's no question that the White House made mistakes, and the lack of consistency was a big mistake. And also the lack of using the White House as an effective bully pulpit to really galvanize the collective action that could make a difference on the margins. Allowing this to sort of get divided along political fault lines in the setting of an election when things were already, the temperature was already very high, I think really hurt us. But stepping back from that, I think that there were fundamental weaknesses with our response that, regardless of who was in power, we had an ill-prepared bureaucracy. We didn't have the right infrastructure. We didn't have the right agencies. The agencies weren't properly empowered. So even if you had competent leadership, very effective leadership up and down the chain, you still would have had some of the same problems.
The full conversation with Dr. Gottlieb about his book, Uncontrolled Spread, is in 2 parts on our website at facethenation.com. We'll be right back. That's it for us today. Thank you for watching. Until next week, for Face the Nation, I'm Margaret Brennan.